Welcome to the office.
Thank you.
What brings you here?
I've just been dealing with a lot of back pain
Okay.
for over 10 years now.
10 years of back pain.
Yes.
And it started where?
At first when it started, it was most like shoulders, upper back.
Okay.
And then now within the past like 6 months, it's tailbone and sacrum, lower back.
So hold on. 10 years ago when it started, did you have any injuries?
Yes.
Did you do something? What happened?
Not 10 years ago when it started. It was 20 years ago.
Okay. So what happened 20 years ago?
I was in a car accident.
Okay. Well, can you describe the
I
accident?
got rear-ended.
Yeah.
I was in the back seat, and the whole back seat just like flipped forward.
Okay.
And I got hit in the head with something that was in the back.
So that was 20 years ago.
Yeah.
And in terms of the pain and symptoms, did you have treatment? Did you have x-rays?
I did see a chiropractor.
Okay.
He just cracked my neck a few times.
Did you get x-rays?
No x-rays.
Were you explained anything?
No.
Okay, so you got some adjustments, manipulations, something.
Right.
Felt better?
No.
Okay. How long did you do that for?
I've only went a few times.
Okay, then what did you do?
Then I just dealt with the pain.
How do you deal with pain for 20 years?
I don't know. You just learn to live with it.
Painkillers?
No. I just stretching.
Okay.
Exercising
Okay.
helps a little.
Okay. So that was 20 years ago.
Right. In between that accident and now, a lot of other things have happened.
Okay.
I had a ankle injury.
Okay, right ankle?
Right ankle, playing
Okay.
soccer.
Okay. You played soccer?
Yes.
How many years?
About 6-7 years.
Okay, what was your, were you forward, defense?
Mostly
Forward. Okay, so you're a tough girl.
Yeah.
All right. All right. And so that was the major injury in soccer?
Yes.
Right ankle.
Right ankle and tailbone also.
Tailbone. Tell me about the tailbone.
I was running, playing soccer. I slipped on the wet grass.
Okay.
Landed right on my tailbone.
Okay.
I felt like a wave of shock just go all the way up my spine.
To the top of the head?
Like back here.
The base of the skull.
Right.
Okay. You saw anyone for that?
No.
No. Dealt with it.
Dealt with it. Didn't really feel anything after that.
Okay.
I was
So
a
no.
kid, so it's just
Tough.
yeah.
Had to toughen it up.
Yeah.
Right? Otherwise, what happens? You can't show weakness.
Right.
Were you a starter?
Yeah.
Yeah, you can't show weakness. Okay. So why are you here now?
I think all my injuries have just like caught up to me.
Meaning what? How has that affected
Meaning-
your quality of life?
Meaning the pain, I can't take it anymore. I can't.
The pain.
The pain, I can't handle it anymore.
Okay.
I can't.
Is it limiting any activities or
Just
routines?
Everything.
Like what?
Just life, just like waking up in the morning.
So waking up in the morning and what?
Hurts.
I hurt.
My back hurts.
Okay.
My tailbone hurts.
So
Right.
wake up, things hurt.
Right.
Okay.
There's times where the pain is just really unbearable. I can't get out of bed.
So what do you do?
I take ibuprofen and just go to sleep until it goes away.
And you've been dealing with that.
Yeah.
So more ibuprofen.
Right.
Did anyone talk to you about any icing or nutrition or enzymes or any of that stuff?
No.
You've seen other people for this? More recent in the last 5-10 years?
I went to my doctor's office.
Okay.
Because I did have
Family? Family doc?
Yes.
Primary, sorry,
yes.
PCP. Yep.
And then I had like really bad hip pain, and I thought maybe something was wrong with my hips.
Okay.
So they did take an X-ray, and they said, "Oh, nothing. Everything's fine. So here's some pain meds.
More pain meds.
Just go."
Okay.
So.
Are you sleeping? Do you have to take pain meds to sleep?
No, but I feel like I don't sleep, no
Okay.
matter what, whether there's pain or not. Kind of a little bit of insomnia.
Okay. And that's affecting family then, I'm assuming?
Yeah.
And that's a bigger issue?
Right.
Because now we got family to take care of.
Right.
Yes. Okay. All right. Any other injuries specifically I need to know about? We have right ankle, tailbone, and
Right knee.
right knee.
Yes.
Okay. What happened with the right? Is that still soccer or is it this
no,
after?
that's after just exercising. I was
Okay.
doing exercise videos, and I was probably doing the form wrong.
You were making exercise videos?
No,
You were
I was
doing
doing
exercise?
exercise
Okay.
videos.
Okay.
And I think it was just too much repetition and just bad form.
Okay.
And there wasn't a day where I actually hurt myself,
Okay.
but the pain just gradually came, and then I couldn't even take one step without pain. So again, I went to a doctor,
Mm-hmm.
got an MRI. They said I had an old injury and a cyst, like in the back of my knee.
Baker cyst. Sound
Probably.
familiar?
Yeah.
Yeah, it's called a Baker cyst.
Yeah.
It's not the cause of your pain.
Yeah, so again, they just gave me payments.
They didn't say to drain the cyst?
No.
Just deal with it?
Yeah.
Maybe it'll go away?
Did some PT.
Okay.
Worse. They tried to give me
What kind of PT?
just physical therapy.
What does that mean?
Like exercises, stretches.
Like what? What does that mean?
They were just telling me, do this and lift your leg up and roll the ball with your foot. And I just was telling them it wasn't working. They did some icing, ultrasound.
Okay.
Didn't really work. They tried to give me like the cortisone shot.
Okay.
I refused it because that just masks the pain. It's not
Okay.
gonna, help me in any way in the future. So what I did was I just researched and just tried to strengthen my knee.
Specifically, what were you strengthening? Do you know?
I think it was this
VMO?
muscle here.
Vastus medialis obliquus.
Okay.
It's called the VMO. It's that muscle right there.
Okay.
Is that the one you're talking about?
Yeah.
You mind? This one here?
Yeah, and I have like a
Or the-
little lump right here.
Can I just bring this to this, please? Okay, come over, and we're talking about what? This lump here?
There was something that when I bend my knee, that sticks out.
Okay.
That used to hurt.
Doesn't hurt now?
No.
Okay. We'll talk. We're going to check the right knee as well. We'll check it all. A VMO is a shunt stabilizing muscle, which means in order to activate that VMO, you've seen the big bodybuilders with that big, well, we're not trying to get it that big, but it's a stabilizer. It's not a primary mover, which means you got to work everything else out, and that's the last thing to do. And there's some easy stuff I can show you just to do at home, in terms of the VMO, but we got to get to that first.
Sometimes I get up leading with my right foot and just my leg goes out.
From stability or pain?
Stability.
Okay,
And
so
there's pain also throughout the day.
okay, so pain, instability, and any weakness, like going upstairs or downstairs. Do you feel weak on one side?
Going upstairs.
Going upstairs.
Yeah, I put pressure like on this. Just,
And going down is okay?
yeah, going down is fine.
Now, typically, the way we're taught, someone who tells us going upstairs hurts the knee, it's usually a femur issue.
Okay.
Someone who says pain going down the stairs, usually tibia issue. And we're going to test valgus varus stress. We'll figure it out. Okay? Sound good. Anything else?
I had another fall in my tailbone.
When?
Maybe about 8 years ago.
Okay. Doing what?
Walking down the stairs with my newborn.
Okay.
And I slipped. So.
You saved baby?
Yeah. So I had
Of
to
course.
hold her and just.
Maternal instinct and just deal with it.
Yeah.
Did you land the same as you remember before, or was it a little different to
No.
one side versus the other?
The first time I landed was more like just really hard and
Blunt, right on it.
Right.
And this one was
This
more.
one maybe was a little more to the side. I don't know, but it wasn't just on my tailbone.
Okay.
It's my whole backside.
All right, so how did you get here now? Now the big question, how did you get here? It's been 20 years,
Yeah.
work in progress to get to this point.
Yeah. Well, I've been watching your videos for about a year now,
Okay.
and just recently for my birthday, my husband offered me a gift.
Okay. It's kind of cool.
Yeah, he said, do you want this gift or what do you want for your birthday?
Okay.
And I said,
What's this gift? What's the gift?
The gift was a Chanel purse.
Okay.
And,
So a Chanel purse.
right, and I said, no, I don't want it. I'd rather go see Dr. Rahim and just,
I appreciate
I
that.
need the help. more than I
Chanel
need a
purse or
bag.
Dr. Rahim? Now, question. This is our second visit.
Right.
Was it worth the first visit coming?
Oh, yeah.
Now. So it was worth giving up the Chanel bag for the first visit.
Yes.
And tell me what's different now today. We've seen you one time,
Mm-hmm.
and it's been about a week, yeah?
Right.
Okay, so tell us what's different now.
So something that I did not expect was to be able to sleep better.
Okay.
So the first night when I went home, I slept through the whole night, which never happens.
Kids didn't wake you up? Nobody woke you
No.
up?
I just was out.
What did hubby say in the morning?
He didn't say anything. He sleeps through the whole night, so
Okay.
he didn't notice.
Okay, all right. So you had a good night's sleep?
Yes.
Okay, how was your mobility since?
A lot better.
Okay.
I feel my left leg makes more of like a longer stride.
Okay.
My right hip, it just like opens wider now.
Okay.
I haven't had pain in my lower back since, and I was having it about every day.
For 20 years?
Yeah.
10 years?
Yeah.
5 years? Even 2 years?
Gone.
Okay. Well, that's not cool. It throws the whole thunder away now. What are we going to do? I'm joking. We went through a lot that first visit, okay? And I appreciate you sharing the story because it's important. People don't have to live like this for 20 years, 10 years, or even 1 year, right? There are answers out there. And am I the only one out there? No, there are a lot of people out there. It's finding the one that's right for you, okay, or the right match.
Right.
This office, you remember first visit, I said, you want me to be nice? You want me to do my job? I always like to be respectful to everybody, but I got to do my job.
Of course.
And it's not about sugarcoating what's going on. People want to know, and they have a right to know. You have a right to know what's up. Right?
Yep.
All right. Can we get started?
Yes.
Is there anything else you want to share with me?
No.
Okay. We're going to go over your films. What did your kids say about, Mama being in pain all these years, and then you came for a visit?
Well, my daughter, she was excited because she's the one that's always massaging me and,
Okay. Did you have to get a massage from anyone, or?
My daughter massaged me for about an hour.
Did you still need it in terms of, or you?
Well, I was just sore after.
First night, first day?
A couple of days.
Couple of days.
Yeah, the lower back.
Lower back.
Yeah.
Last night, were you sore?
No.
Did you wake up last night?
Yes, I did.
From pain,
No.
discomfort,
No, just
life,
yeah.
stuff. Okay, fair enough. This is a picture in time, tells us how you've evolved from birth. We have 24 bones in the spine, 23 discs in between. I want you to think of this as a 24-story building, and this is the foundation of the 24-story building, which is the sacrum and the pelvis. Now, we can see, do we look symmetrical and balanced? That's the first question. Are these holes, the obturators, the same size, same shape? This is smaller, this is bigger. You can see the pubic bone here, you can see the crease of the bum here. It looks a little bit off, right? Mm-hmm. Okay, the hip joints, we talked about it. This one, you have a good hip joint in through here. This one looks like there's a little extra tension on that left side. And then when we look at the tailbone, what do we see? Looking at the sacral tubercles, we have 5 sacral tubercles, and these 5 segments fuse and become one solid sacrum by about 32, 34. You remember us talking about that?
Yeah.
And we said that there is a little bit of a bend in the tailbone. Yeah? And we're going to go to the side profile now to look at that and see it. And this is what I was talking about, this nub right here. This was the fall, one of the falls. Okay, so we have sacrum that we need to deal with and work on, we talked about. And let's look at the numbers of the pelvis and the foundation, and let's see what's off, if anything, here. Now, 233, 232. We do have about 5.7, close to 6 millimeters of rotation here. We have 4.2 millimeter leg length inequality on the left side. So the first thing is anything under 7 millimeters adjustments will hold in terms of leg length inequality. There's nothing we really need to do for that. Okay? Yeah. Now we have the bigger number and the smaller number. And the way I explain it is this. Pelvis normally sits on a slight angle. When it misaligns back, the vertical distance will be larger. When it misaligns forward, the vertical distance will be smaller. We have a rotated sacrum on the right, so I'm going to reference this side here. Yeah? What's happening is, this is the sacrum, the tailbone. The pelvis on the right, the ilium, has gone up a little and turned in. And the sacrum on that same side is turned to the right. So your body favors to the right, but there's a short leg on the left. So I'm assuming we're going to get a little bit of a waddle when we walk. Okay, does that make sense? Yes. Okay, so rotated sacrum on the side of an ASI and ilium. What does the book say to do? The book says if you have that, page 43 of the chapters, it says, do the sacrum. Okay? And then we'll talk about where we started on the first visit as well. So, right side sacrum. Once sacrum is stabilized, we go to the pelvis for the final fix. Now, let's slide this down. Let's look at the SI joints, change the contrast a bit, and we talked about these joints in through here. Good joint, little. Is it that this is smaller here or there's more swelling in here? I think there's a little more swelling here on both ends. Let's change the contrast. Let's follow it up the spine, and let's see what else we find. Now, from the base, if this is our base, okay, the first one to come off the level base is 5. Subtle, right? And what does it do? 5 takes 4, 3, 2 comes back to normal. Yes? 2 comes back to level. Next one to go off is T11. And T11 is going to take 10, 9, 8 comes back to level. 8 comes back to level. Next one to go off is 7, and 6. So we have all these compensations happening through the spine, yeah? And all of that is a function of what? Down low. But now from here, you can clearly see 7, then 6. That takes the whole neck over, yes?
Yes.
Now, question, and it's kind of a rhetorical question. We do have some digestion issues, yeah?
Yep.
And we can talk about it from what do we see here on the film. This is the Blvd, somewhere hiding in there. This is actually the colon, but the Blvd is the gastric air bubble. It should actually be half a black circle that big. I don't see that, number one. Number two, we look here and we have what's called a permeated moth appearance. Okay, so we're not really absorbing and assimilating as well as we should, at least from what we see here. Then we see here, it appears that the left shoulder is higher than the right. It is not. It is, well, it is, but it's due to the spine.
Right.
Right? Now, let's go up and let's look. What do we have here? We have a little bit of jaw deviation as well. We can see it's deviating from the right side. Left side is compensating. This is a little more serious now. We need to get into the upper cervical. I can barely see that in there. I can see that in there. So there's been a lot of abnormal wear and tear in the neck, and that's coming from what? Alignment and posture. Okay? Now let's talk about this, the side profile. We did say there's a slight bend here in the low back. That's where we started, and that's where we're going to continue unless something else shows up. We also talked about having the right curvature, right? That we need to have the appropriate 60-degree curves in order to have a stable structure, and it's our first line of defense against the forces of gravity. And we can see we don't have the curve, right? The lack of curve comes from your ASI and ilium. Watch. We know the sacrum is rotated back, but this is what the ilium, this is how the ilium plays. If the pelvis goes up, sacrum rotates back. Posture. Plumb line should pass L5. That line should pass through C2 and C7. It's similar to some offices doing a weighted string, and the only thing I want to show you here is the upper body is behind the foundation, so we need to push that forward. Okay? Any questions?
Nope.
Let's watch you walk and let's get started. The next thing we want to do is we're looking at the symmetry. Okay, we talked about the right shoulder being higher, but as I showed you on the x-ray, it's coming from the kinking in the spine. So it's kind of futile in this case to try to fix the shoulder by working on the shoulder. You know, oh, we have inequality, so let's push this one down and strengthen this muscle, stretch this out. No, it's coming from the curve in the spine first, then you can rehab it. Now, what we're going to do, we're going to watch her walk. We have some swelling here in the sacrum. When we're looking at the symmetry, we said this is a little bit higher. When we're looking at her ears, the right side is a little bit higher and comes back a little bit on that side. When we're looking at the musculature, we can see the tone is a little bit more pronounced on the right side than it is on the left side. Okay, can I have you walk? Let's see. And where are you coming from?
Palmdale.
Not too bad of a drive, hopefully, yeah?
No, not too bad.
Okay. Now, as she's walking, let's watch the feet first. Let's see how the feet are moving. They cool off over there in Palmdale?
Yeah, got cold.
Got cold. It gets cold. Getting cold here too. So she is swinging her arms. Turn around. Let's watch the dimples now. And what I want you to see, it goes up, but it doesn't really come down. So what happens is it's doing this. Up and to the side. Up and to the side. Keep going. Up and to the side. So we got a little bit of that Palmdale wiggle going on. All good. All good. All good. Keep walking, please. We have pronation, bilateral toe in as well. Bilateral toe in coming from the sacrum. We will be dealing with your feet down the road. I want to go over the Bunion Protocol as well. You are developing that. I want to go over that, talk about that. We probably won't do it on this visit because we first have to work on the ankles, right? And as the ankles are getting better, then I'm going to go through that Bunion Protocol with you, okay? Cool. All right, so we got a little bit of that wiggle. It is better than before, though.
Yes,
okay, much better. Okay, have a seat, please. Now, starting at the base of the neck, we're getting 10 points, C6. Left side, 11 points. Top is clear. 10 points, C6. Doo-doo. T7, 8, left side, a little bit higher, so it's between 6 and 8. And that's part of the area. Scoot back a little bit for me, please. And you can see, I don't like seeing the bones like this because the way she should be sitting comfortably should be like that. Okay, we want to see that line. Now, just sit whatever's comfortable at the moment. And we'll continue. Cool. And 11 points, S3, S4. So consistent with our first visit, yeah? Okay, S3, S3. We have between T6 and T8, and we have the base of the neck. Head down, please. We want to see a nice smooth arc. You can see it goes here, dips in, comes out, dips in, that way, and then we start to see the bones here. That's going to be a good test for us. 7, 1, 2, 3. As we statically palpate right around 4, we get that pooling edema. And it goes all the way down to there. Tender. More tender there. Or there? Top one? Mm-hmm. How about the one above that?
A little bit, yeah.
This one more, the bottom, or the top?
Top.
This one. Okay. 1, 2, 3, 4, 5, 6. T6. Okay, follow the fingers. Swelling continues all the way to right there. So it doesn't stop here at 5. It goes down, bend forward slowly, into the tailbone right there. S3. Okay. Let's check movement of your pelvis, please. Feet together, open and close the knees, open and close, open and close, open wide and close. Left side only, please. That right's not moving. Right side only, please. And it just wants to right up high. Okay, scoot back for me, please. Right there. I got to push pretty hard. S3, S2. Okay. S1, S2, S3. You know what kind of sucks? We started on 3. 3's fixed. We're moving up to 2. Now, people will say, how do you go from S3 to S2? These tubercles came from that fall, right? So we're kind of remodeling it for you, for lack of a better term. Okay, sit back for me. Let's get started. We're going to do C6. We're going to do T7 as a PRS. We're going to do C6 as a PLS. And we're going to do S3. Sound good? Left hand up, please. And down. There we go. C6, PLS. Now for C6, we're going to be on the distal palmar surface of the index finger. We're on the inferior lateral aspect of the spinous process. The idea with C6 and the lower cervical is we've got to really get underneath it and lift it to get the set over the disc, okay? We're going to come down and it's going to be a set up. Up. Beautiful. You good?
Yep.
Okay?
Yep.
Face down, please. 2, 3, 4, 5, 6, 7, T7. Nice and easy there. Gotcha. A little more. There you go. Excellent. S1, S2. Okay. You good? Good. Good. S2, easy. That's the home run, lady. Beautiful. Awesome. My hand. Come off slowly and let's walk. But you'll see now there's a little bit, it's coming down a little bit on that right side. Keep walking. Tell me if anything is different from just that.
I don't feel as much pressure in my back.
Okay. Keep going, please. Back over here, have a seat. All right. Ha. Little different in her sit. Is it easier to sit like this at the moment?
Yes.
Cool. Head down, please. C6 is clear. And that's going to be our focus, okay? The idea is this. We don't want to be jumping around all over the place, right? We want to focus on the segments where the pressure is. Each time should get less and less, because what happens? You know, people ask, why do you got to get adjusted? Why can't I just hold one time? And that's just not a reality, people. Right? Why? This is live tissue. And we have the ligaments that remodel or shorten. And so what happens is each adjustment, it goes home, but then it wants to go back because it's been used to being out, right? All clear, young lady. Let's recheck, please. Sit up straight, back towards me. L5. S1. S2. I'm pushing harder, ma'am. Bueno? S3. Bueno? Bueno? Right side of the joint. Top of the joint. Middle of the joint. Bottom of the joint. Diferente? Little bit. Yep. Moving better. Left side. You're good there. Can I continue?
Yes.
Ears. Nice. Shoulders. Over, around, down. Over, around. There you go. Let's go on your back and do your ankles. You're not as excited today, are you? It was a lot more dramatic that first visit. It was a lot more dramatic. She was like, ah! I'm just playing with you. 20 years, why the hell are you dealing with it? It makes no sense to me. You understand? Yeah. It makes no sense to me. Help me understand why somebody, I
believe it's just regular medical doctors.
No. How can you live with it for 20 years? I don't get it.
Oh, I don't know.
Is it from frustration? Is that what it was?
Yeah, maybe.
No, meaning like you're saying
Yeah,
you didn't get an answer.
I wasn't getting any answers.
People want an answer.
Right.
Yeah.
That's what I told you the first day. I said, I need to know.
Are you clear what it is now?
Yes.
You are clear?
Yes.
Okay. Now the fun part. Hubby's not here to hold your hand, but if you need, if it's too much, tell me.
It's not as bad as it was.
Yeah. Good. It's not as bad at all. So that's a good question. Then people are like, so how long does it last? You know, and as we talked about, this isn't about me giving one or two adjustments and everything is fixed, right? What is this about? It's about get an answer, what's out of balance, put it back in balance, and change your habits. What did the kids say after the first visit? A couple of days.
They're just way better now.
Did they see a difference? Did they mention it a few days later?
Yeah, they're just saying that I'm not, like,
You're not as cranky?
right.
Got it. 5, 4, 3, 2. I'm working the periarticular swelling. This is all that old swelling. Look. You can see this right here. This is all that old swelling that's just hardening up because no one ever bothered to explain it to her what it is. 4, 3, 2, 1. 5, 4, 3, 2, 1. AS talus, medial tilt. Let it go. Wow. A little more. You okay? It's not going to go that way. We got to use the board. Raise the right leg. AS talus, medial tilt. Posterior fib. Turn to your left side, please. Calcaneus, posterior lateral. Bend the top knee a little bit, please. Turn to the other side, please. Did you call your mama at least?
Did I call my mom?
About this?
Oh, yeah.
Oh, yeah. You told her after the visit, yeah?
I sent her pictures of my ex for a reason.
What'd she say?
She said she might be coming.
Okay. She's in Palmdale also?
Yeah, she got here in Reseda.
Oh, okay, cool.
She was also in that car accident, so.
I'm sure we're going to see mama.
Yeah.
Yeah, we're going to have fun with this bunion. I'm going to start it right now, at least a couple parts. 3, 2, 1. On your back, please. If anything is too much, you just tell me to stop. Otherwise, I keep going.
Okay.
All right. Awesome. Hi. Ah, there we go. Patellar tracking. Bend the knee. Bend. Good. Bend. Valgus and varus stress. Valgus is in. Varus is out. Okay. Now, valgus varus stress this way. You can feel a lot of that swelling in the back here. You can actually see it too. And that's what you're talking about?
I felt that, but
You feel the clicking?
Yeah.
Come here. Mira. Ah. Check the other side just to compare. Kind of there too, right? But more there. Guess what? I got to pull your knee today. Let me show you what I'm talking about. They're both kind of swollen. That's what you're talking about?
Yep.
That's the cyst, but she's got a posterior tibia. It's gone posterior and on the external side. I'm going to show you with a knee model. This is the knee model, femur, tibia, fibula. So what she has, there's a cyst here called a Baker cyst, which forms. They don't actually know why it forms. What we see is instability. The tibia is gone, posterior, and slightly on the external side. So we're going to bring it back up and set it in place. And before we do that, let's use a little bit of lotion. All right. You feel that? What's that?
What is that?
This is the bulging of the capsule of the lateral meniscus of the right knee. And we need to work that back in, otherwise nothing fixes. 5, 4, 3, 2. Hold on to the table, please. Good. Posterior tibia on the, take 2, 3 fingers on the lateral joint and the meniscus. Bend the knee. Hold on to the table. Good. Let me do the work, please. Superimpose piezoform on fingers. Just open it up a little bit. Can you give it to me? There you go. A little bit more. You good? There you go. Mira. Different? right there still. Hold on. You gotta let it go though. You gotta give it to me. Give it to me. There you go. Awesome. Come up, please. Good job. Stand up. Ha 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 ha. What's different right now?
Just the whole leg.
A little smoother.
Yeah.
One more time.
When it bends, it feels different.
Her dimples are going up and down now. Come here. Turn around. You made me work today, yo. What's Mama's name?
Maria.
Maria, I'm waiting for you. Walk, please. Maria, I'm waiting. Look at her dimples, Maria. They're moving up and down now. You're actually swinging your arm a little bit. Good. Over here, have a seat. Sit back for me, please. Jaw. Okay. Look up. Slowly open. Keep going all the way. Open all the way. Slowly close. You can see, so go, open, goes all the way there and comes back around. This is a right AI, left EX. We need to do the left side first, okay? And I'm pretty sure once 6 clears, we're going to need to work up top there. And when we get up there, it's going to also help this. Okay? Open all the way, Close halfway, hold. Oh, nice, it moved. Beautiful. Slowly open, slowly close. Slowly open, open, slowly close. Slowly open, open, open. Close halfway. Good. I'm going to do the machine and then recheck everything. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. Awesome. Now let's do the rest. Open. Now we can do that right side. Yeah, I'm pretty sure once we get to that upper cervical, it's going to change a lot more. Open all the way. Open, open. Slowly close. Come on. Open. Open. Slowly close.
Oh, I felt that one.
That's where we're going to start, okay? Now, open. Does it feel different?
Yeah.
Yeah. Open. Okay. All good.
It's not shift.
Yeah. It's still shifting, but it's not as much. Questions? Stand up. Let's do the hands. Squeeze. Squeeze. Elbow. Radial head. Posterior. Lunate. Posterior lateral scaphoid. There. Squeeze. Posterior ulna. Posterior ulna. There. Posterior lunate. Posterior lateral scaphoid. Not much left. Squeeze. Squeeze. Any other questions for today?
No. Thank you.
All right, you're welcome.